Good morning, everybody. This is Dr. Rao, Monday morning from yesterday's Holistic Health Challenge. Kind of seeing the questions, it looks like people want to know more details of the some components. So I thought I will do for a few days on how to really start the day so that we can inculcate proactive wellness not only in our bodies and our minds and in our hearts, but also when we go to work, how do you deal with stress and all that? Those things I was talking about yesterday to develop inner resilience, right? How can you do that? What is the morning routine I was talking about that addresses holistic health point of view? That means all your different layers of the body we talked about. Okay, so anyway, for those who do not know me, I'm Dr. Rao Kolusu. I'm an internal medicine doctor trained in India and here, and practiced in this country for about 40 some years. And I'm also a very active enthusiast of preventive medicine. And now I call that proactive wellness. To be well, and you got to take things into our own hands, not to give to anybody else. If you know what is wellness in a comprehensive way and do some stuff in the morning before you embark on the work, then you can develop this inner resilience in your body, in your mind, in your heart, and in your spirit. And while you are going and dealing with the world out there, you can deal it much better with responding to the challenges, not reacting emotionally and getting drained. And also get a lot of feedback from your work and whatever you do to nourish you. Okay, so simple things that we could do, like we do comprehensive self-care of eating well, exercising optimally, and sleeping better and resting better, and not to get too much excited about small things at work, and taking a laid back approach, but at the same time being intensely focused on what you're doing, and not letting your mind go all over. And when you come home, you sleep well, and you go back to the work in a more powerful way, rather than being vulnerable to every small challenge that comes out there. Okay, so what I call proactive wellness is we want to be proactive about being well. So we do certain things, and it starts with the day in the morning. Okay, so I'm going to focus only on that. And I thought I will do a daily program so that you can come and start the day with me and pick up these insights and incorporate them into your own routine and see how that helps you in the long run. Okay, so it will be like an ongoing series. As long as I want to, I will do this and I will help you to understand what I call morning routine in my wellness club, which is done much earlier. Because I get up early, I have a lot of time. 8 o'clock is a good time for me to come to here and share my insights and encourage people to come on stage and ask me questions about proactive wellness that I can engage with you. Basically, I want you to do deep breath and stretch your body for energy and focus on the movement and observe your thoughts. And you can be non-reactive when you are used to the deep breathing, and also being considerate and not being impulsive, and develop a service attitude and appreciate where we are all equal and go with that attitude. So So if you can understand what I'm talking about, then you stretch in the morning, but you always be aware of what you are doing and align your body as it is stretching with breath and with your mind being here, not letting the mind go all over. So only two A's you want to remember. You want to be aware. Aware is not being in thought, but in being aware of what is going on here and now, right? And that means you put the thoughts going all over, but there's a focus on what is happening here in your body, in your mind, around you, in your room, surroundings, and all that. And then with my voice, what I'm trying to tell you, what is going on here. And then if you have relevant questions, feel free. This 1 hour is going to be like that. It's not going to be the other day, the practice, but we will go into the practice a little bit. And as we are showing different things, we will be doing. Okay. So 7 principles we want to cultivate. Okay. That's simpler, right? Deep breath, number 1. Stretch the body for energy, number 2. Focus in the moment, number 3. And observe the thoughts if they should come, and how to develop that habit. And be non-reactive to stimuli that come from outside, and develop a service attitude, and appreciate the equanimity everywhere we are in, right? So these 7 principles, how do you do it? You start the workup with a stretch that is associated with the deep breathing and being in the moment. And at the same time, if the thought should come, you can observe them and let them go. Okay, those 4 are covered right there, right? And then you will be reactive all the time. So watch that and carry that non-reactive responding attitude to the work, right? And to also go with an attitude, I'm serving somebody, and I'm equal to everybody. Nobody is superior to me, nobody is inferior to me. We are all in one tribe. Okay. So as you do the stretches with the breath and with the awareness of the moment and observing the thoughts, 4 things are done. Rest of the things are the attitudes that you're going to cultivate here and then take it to the work. Okay. So we will talk on each one of them specifically if you want to talk about. But this is an introductory class of my intention to share my morning hour with friends out there in the social media. And anybody can come and join. And I am open on the several platforms like I usually do: Clubhouse, Noom Vibe, and on the StreamYard, YouTube, LinkedIn, and Facebook. I'm open on all these things. Probably tomorrow I'll put on the Instagram also, because I have followers there too. So this is more like a service. I just want to give this service so that people have insight into what is proactive wellness, how they can maintain their wellness without going to medical care for the clinics and hospitals. You can go, you can test yourself and get, that's all okay. But what is that you are doing to be well by yourself? That's what I want to teach. I want to teach you not only eating well, not only doing optimizing your exercise, but also how to rest and how to have quality of life, quality of sleep, and also how to really use the thought when it is needed, otherwise keep it at bay. And also don't react to everything that's going on the sun. Okay. So if you can grasp it, at least a few principles of this and implement them, that's more important. Not coming and asking and questions and discussing, arguing, that are okay to learn. But once you learn a truth, make sure that is part of your life. Then only you will have wellness proactively protected. Okay. So If you are not involved in your comprehensive self-care, that means you are getting up in the morning and doing these exercises and having a breakfast and then going out there with a equanimous attitude, with a service attitude, and you're not reacting attitude, then you'll have a good day at work, and then you'll be able to come out feeling accomplished something, serving something, providing for a bigger cause. All that will be in your forte. Okay, so what we will do is we will uh, spread this message that I'm doing this at this hour. I will do it myself. I will do some social media posts and some polls and also some teasers, some short videos regarding this. All that I will release that so that you will be informed, aware of what is coming up on these hours. Okay, basically I want to get up and do my wellness club that is in the morning. After that, I want to come here by 8 o'clock, spend another hour either teaching you how to breathe deeply or how to stretch for energy, how to really focus on the moment, how to observe your thoughts, and how to be non-reactive, how to be service attitude, and attitude of equanimity. All these are simple things to do, but you can do. As far as the breathing concerned, there are so many ways you can practice, so many things you can really uh, do your breath. First of all, sit down and calmly observe how you are breathing. Okay, what is that you are doing at this time? Don't comment, don't judge, don't blame yourself or anything. If you are breathing shallow or if you are breathing deep. Okay, the deep breathing is when you take a deep breath through the nose, your abdominal wall will raise and you will be getting your breath go all the way into the lower part of the lungs, right? That's why always you sit straight, keep the neck straight, and close your mouth and breathe through the nose. Up to 7 count, deep breathe in. Hold it for 4 count and release for 8 count. Breathe out and abdominal wall goes towards the spine. See, that you can repeat up to 7 or 8 sets. Some commonsensical things that you want to do with this is come to the deep breathing sessions with an empty stomach. So get up in the morning, go to the bathroom, empty your bladder and bowel, and then come here wearing loose clothing. And then sit on a chair with, don't, put your back on the rest of the chair, but then come to the front of the chair, sit straight with your spine straight and neck straight, and then close the mouth. And as you are in this posture, you can take deep breath in while you are bringing the abdominal wall to the front. That means it comes up, right? And then hold it like that for a few seconds, and then don't have to do so much, okay? Just to start with that. And then as you breathe out, let the abdominal wall go towards the spine. That means it is pushing the abdomen to the back so that it will pressure on the diaphragm and the air will come out. Okay, so very simple, but you want to do a count of 8. If you just do this, this is called Bhastrika, normal breathing. If you can do this deep breathing up to 8 times in the morning, 8 times before lunch, 8 times before dinner, this will do a lot of good for you. Again, Bhastrika. Again, once again, I will show you one more time. Sit straight, close your mouth, take deep breath through the nose. 1, 2, 3, 4, 5, 6, 7. And then hold it there for 4 count. 1, 2, 3, 4. Now breathe out as the abdominal wall going towards the spine. You breathe out for 8 count. 1, 2, 3, 4, 5, 6, 7, 8. That is 1 round, right? You do 8 rounds like that. Now I'm going to do, without speaking anything, at least 4 rounds, okay? So let's start number 1. Number 2. Number 3. Number 4. I can go on like this for some time, but since this is an introductory class and so many features we want to explain and we want to take it on a daily basis, it becomes much more easy as we go into the 1 week. Okay, so I'll be doing this on every weekday, and you can also start the day with me and ask me all the questions regarding proactive wellness, all the components of the pillars of wellness, all the things that you can do in a comprehensive self-care, and all the things you can do, holistic health maintenance, all that I will discuss. You can ask me about ancient wisdom questions or modern medicine questions, or anything in the general life that is giving you stress and burnout. I will try to give you my answers through whatever I read and learned, and I keep on learning every day. So I may have some answers, but some answers I may have to look it up. We will look it up, especially with the Ayurveda, Yoga, Vedanta space like that. Okay, so this is more like keep your doctor, do what you are doing for your health, but learn these good principles to preserve your wellness for the long term. Okay, so my goal is live well for long and enjoy, not in misery, not in weakness and debility and all that. Okay, enjoy your body, enjoy your mind, and enjoy your work and family by being well. Okay, so if somebody gets sick and goes to the hospital, the whole family gets affected. Either their routines are disturbed, or they have to take leave from the work, or they have to spend money to go to the hospital and come back, or they have to spend money to buy the medications and tests and all that. Okay, it has become a big menace around the world. There's healthcare which is just trying to fix the sickness and promoting the sickness, but not helping people to behave such a way, or do activities in such a way that they won't get sick to begin with. Okay, or you help the body and mind become more resilient so that they can face the challenges of life with that strength, not with the weakness of sickness. Okay, so that is the idea. That's why we are doing this. So if you understand my spirit of helping people to be well for a long time and enjoy, then direct me any questions related to that, or in your experience. Suppose you are not able to sleep well, bring the questions here. Suppose you are not able to eat holistically, bring them here. If you are not able to exercise because of some limitation in your body, or some recent surgery, or whatever, right? Then we can help you to recover better. We can help you to get stronger sooner and all that. Okay, so you can do a lot of things on your own, and then consult your doctor, inform your doctor what you are doing, and then you will be healthy and well. So don't fire your doctor, but just keep the doctor do what the medications he is doing. Then understand how you got this disease. Is it because of the genes, or is it because of the lifestyle, or is it because of your own not caring about that and then only attending to it when it becomes too painful? Okay, lots of people do that. They don't take care of their health. They will give it to somebody else, either your medical system or your society, or you blame somebody, something like that. And also not paying attention to what is going on within our bodies and within our minds and hearts. That's a big deal too. So this session is going to be just for providing people tips and tricks and points that they can take and apply in their life, so that they can lead a holistically healthy and well body, mind, and heart, and function well, and um, get your success if you want to, and then um, the success of sharing that with your family and friends and the work area. All those things require that you be well first, right? And you can go and work hard, that's okay, but then you can attend to what is hurting you and fix that. That's the knowledge we have, both from the ancient wisdom and also modern scientific breakthroughs. We have that knowledge. So apply that. Be smart about being well. Okay. So that's the intention of proactive wellness. So I will do this as many days as I can, and then as many days as people want it. And people are comfortable with it, that's fine. But if you have questions, you can come and ask me here. Okay. So you can interrupt me anytime in this hour. Okay, this is not like a completely only structure, but every day morning I will come and I will share some insights with you. I will give some routines that, like I gave you about breathing right now. And suppose you are sitting in the chair and you want to do some stretching. Okay, clasp both your hands like this. Okay, and then stretch them to the front. Okay, facing the camera, right? And then take both arms up above your head, all the way up. Okay, just to stretch like that, and stretch to the sky. Extend your elbows and stretch to the sky. And at this position, turn your torso and the head to the left side. Taking a deep breath. Breathe out and come to the center. Do on the right side. See, two more times. To the left, take a deep breath. Breathe out and come to the center. Now to the right. Now hold on to the left wrist with your right hand and extend the left elbow and stretch it towards the right. Stretch it. Take deep breath in. Breathe out. And come back to normal position. Now change the hands. Hold on to the right wrist with your left hand and stretch the right elbow and stretch towards the left. Stay there for 3 breaths. See how simple that is? It stretches a lot of muscles in the shoulder area and also to the side of the chest and abdomen. And also it fills you with energy, right? The body. Okay. The other things you can do with a very simple stretches as show me your left palm to the camera and hold on to the left fingers and pull them towards you with the right hand. 3 breaths. Now put the left hand down like this and pull the uh, left fingers with your right hand placed on them towards you. Not only the fingers, but also the hand gets stretched. Now, show me the right hand to the camera and then pull your fingers towards you just by placing the left hand over that. Show it backward like this. Put the hand down on the right side and pull that with the left hand towards you with 3 breaths. That way, both the fingers and the wrist got a workout. Now, raise your left elbow like this, perpendicular to the floor, and hand showing towards you, and hold on to the edge of the left elbow with the right hand and push it towards the right. See? Towards the right shoulder. Do the opposite, right hand bent and left hand pushing the right elbow towards the left shoulder. Okay, if you can see me on the LinkedIn, YouTube, Facebook, that's fine. Tomorrow we'll start on the Instagram also. And if you want a Zoom session, you always request by going to my website, bapal.net. Okay. Now we have done the fingers and the wrist and the elbow and the arm, right? Now you raise your left hand over your head and hold on to the right hand, with the right hand, left wrist like this, and pull it towards the right side. The same you do on the right side. Hold on to the right wrist with the left hand and right arm touching the right ear and pull it. Okay, it's as simple as that. You want to go in an order so that you will do all joints like that. Okay, so it's a question of finding where the tension is in our body. Some people have in the neck, some people have in the lower back, some people have in the arms or shoulders or elbows, or wherever, right? And by allowing this stretch in a safe way and stretch as much as you can do and really breathe into it, that will relieve the tension, and thereby you know that is happening, and you can relieve the stretch. You can relieve the tension, by stretch and breathing into it. So this is the principle. As we go along, we will do more stretching, more joints, and I have done series of talks, series of videos on that, how you can use just stretching for a long time, but breathing in and out at the same time. That will relieve the tension. Then you will know how to work with your own body. What are the vulnerable areas? What are the things that you can injure by repetitive activity? For example, if you are playing tennis, you have to pay special attention to the elbow. Okay, suppose you are playing cricket, then depending on the role you have, you got to pay attention to the legs or the hands. If you are a bowler, hands. If you are a batter, the legs and all. But both have to do general fitness, but specifically areas that are used repetitively in our daily activity, they get tensed, and then the tension leads to injury. So you want to relieve that. Okay, morning is a good time to relieve the tension in the beginning, it is very difficult to do the morning tension relief. So don't push it, go very slow. But if you do the same thing after wake up certain hours and then the evening, the tension is much less gone already. So if you stretch in the evening, you make a rapid progress. So what I would suggest is if you are really tensed up body, start in the evening. And if you have somewhat managed tension, but you can wake up in the morning and then you can do that. If you do the morning, you'll have progress much faster, but it is difficult. But if you do in the evening, you will have easier time to do them, and but not real progress right away. Okay, so understand your body, pay attention to what it is doing, what it is telling you. If you listen to it, if you understand, then act accordingly. Okay, so that is the safe way to really preparing our body for our daily activities, work, play, whatever we are doing. Or we're going on a vacation and we want to go on a hike, and then you want to help your aerobic capacity, or you want to help your leg strength, to climb and all that. So according to the activities that you are doing, you can combine different stretches, and then do them in your hotel room also. Do them on your vacation just to prepare. A few minutes will go a long way to get your energy up and going. Okay, so that's we're going to do more on this stretching too. So number one was really breathing deeply. Number two is stretch good while breathing into it. Okay, and then you can go into the third one, which is more like a focusing on the moment, what's happening here and now. With the stretching, I told you, pay attention to what's happening within the muscle that you are stretching. Feel, is it painful or is it too painful, or is it stretched but then feels good, it's not painful. Like that, you can get feedback from your own body with your activity, then listen to it. Be attentive. So what I tell my students on the wellness club is, be here and now. Okay, you are here, but you are not hearing. That's what I tell them. But if you are here, be here. Focus on what you are doing. And carry that attention for the entire day. Cultivate that being attention. In the morning, when they get a lot of people have a lot of thoughts about their upcoming day, their work, or things that they may have forgotten, or they may imagine consequences with their boss. So many things come into it. Or lack of money, or have to pay certain things, have to meet some deadlines with projects. So many things are there. But it is wise not to get engaged in all those things before you establish yourself in the present moment. I strongly suggest that, be in the present moment first, and then try to establish your mind in there for this 1 hour or so, and then go into your regular day where you perform with attention. Okay, whatever you do, pay attention to only that, and then you get a good quality accomplishment or result out of that work, and that propels you to do more work. Okay, encourages you, gives you strength, confidence, right? So be attentive to everything. My mantra is attention to every action. So you have planned something you want to do. When you're doing, you have several steps they want. You can improvise them, no problem. But pay complete attention to them. Actually, improvisation comes when pay complete attention to things. So that's what we want to do. And then you will get thoughts all the time. And in this practice also, you will be getting thoughts. No problem. But develop the habit of observing those thoughts. Okay? If you can observe those thoughts and not yield to them or not to suppress them, then you have done a lot to not to be overthinking. Think only appropriately, Don't think negatively, think positively, and think only as the situation needs. Otherwise, keep silent. Okay, that's a difficult thing for a lot of people to achieve, but at least be aware and watch the thoughts. That's the fourth one we talked about. Then you want to be more of a service attitude. You want to develop that. You want to develop equanimity. That is also there. Okay, so all these morning routines that I do, I'm doing only minimal for you. This today's introductory day, but tomorrow we can take breathing and do an extensive session on that, and also repeat these six other things, and then we can come back to them next. That is the way I want to go about it. I want to go details on these seven principles that we are talking about. Okay, so if you can really understand these seven principles and you have questions, you can come up now and ask me all these questions, whatever you have. So let us repeat all the seven principles again for those people who are joining for us today. This is about being proactive about our wellness by doing some routines with me in the morning and carrying the messages and everything, or doubts or whatever you are doing can be improved. Deep breath, number one. Number two is stretch for the energy. Number three is focus on the movement. Number four is observe the thoughts. And then be non-reactive and be in service attitude. You are going to go and serve something, okay? And then appreciate the equanimity, because if you don't have the equanimity, then your thought will go all sorts of things. There's a meaning for it. I will go into these principles much more detail, but basically get up in the morning, come and do the breathing, do the stretches, and exercise your mind to be here and now, and also understand what is being non-reactive. This deep breathing promotes the parasympathetic nervous system. So when you go to the office and you have a sympathetic overtone with a lot of reactions within you, this deep breathing helps you as an antidote. So that's why it's very important. Okay. So we will be doing one in detail starting tomorrow, but today is more like an introductory class. Once again, if you want to join my Zoom or if you want to join my wellness club, you can come to my website, beapal.net, beapal.net, N-E-T. Okay, if you can go there, and if you want to register wellness club, that is there, or if you want some question, that's there. I also have a Facebook group which is called Conquer Burnout. If you want, you can go and join there, and you can really ask me questions, or sometimes I come live on individual questions and then talk to them live there too. So there are so many ways you can reach me. You can DM me, and I would welcome to receive questions from you so that I can answer them. Okay, so there are 20 people here, and there's no vibe, So I'm going to follow these people who came here to listen to me, at least, It's a courtesy I can extend, right? So this is a new series just intended to get you going on your proactive wellness. If you are doing some things on the project, come and share with us, and we will appreciate that. Doris is there. Doris, come up. Let me talk to you. I would like to do some programs with these excellent coaches that you have on the Noom Vibe. Collaborate with them and just to contribute to their whatever excellent job they are doing already. I do come on to their rooms and try to participate. They are gracious, very nice. So it encourages me to come to their rooms again, just to share. Okay. So in the same spirit, if you want to come up and share your knowledge, your experience with these things, What do you think about this proactive wellness? See, it's not like getting up in the morning and get going and go and work without knowing what the work is doing to us. What is the work culture, work atmosphere, or general atmosphere is doing to us, but just demanding a lot from our bodies and mind, and we don't prepare for them. What are the consequences? Stress and burnout. People are stressed out, people are burned out, people are not happy, even though they are having very big salaries and a very big status and all that. I know doctors who are like that, right? They're burned out, they're miserable, right? So you can discover all that solutions within you. And that is what I hope to provide in this hour, so that people, if they have individual questions, you are welcome. If you want to, or if you want to talk to me privately, you can always go to my Facebook group, Conquer Burnout. Okay. And then put in a message, then I will contact you and we will have a chat about that. Okay. But if you can share something that everybody else can learn, like you have questions on how to deep breathe, or you have questions on how to stretch properly, or you have questions of some yoga asanas and all that, So here I'm just showing you stretching and deep breathing and keeping the mind in the focus and observing your thoughts and having an attitude of non-reactivity, service orientation, and equanimity for everybody and everything. Okay. If you can understand these principles, each one has a lot behind it. Modern medical field, which I am in, what we do now generally is we wait for the patients to come to us with sickness, and we may do annual preventive. We may do something like episodic testing every 3 months, 6 months, like that, because the economic model, the structure is set up that way that it doesn't allow the time and energy and also the incentive to be in touch with the patient all the time. Good doctors do that. They will tell you to call our office when you need it, but it's not like your own health practitioner is visiting you on a daily basis and looking over your diet, exercise, sleep, and mind functioning and all that, right? You want to take care of that. That means you want to engage in your comprehensive self-care. A lot of people are doing now. That's why we see so many health coaches here that are helping you to lead a record. What I am saying is take charge of your wellness proactively. Before some things happen, prepare your system with resilience, so that they can deal with the life and events and work or family, whatever you're dealing, much better. Suppose you are non-reactive to a lot of things, but you are responding. What happens is, so you go to the work and there's something happens with the nurse and the patient. The patient is unhappy with the nurse's placing an IV or drawing blood or taking an EKG, so many things they do. Sometimes things may not go right way and the patient gets unhappy and he will call the doctor and complain about the nurse. And if I react and then if I alert her, then I'm reacting and at my own peril, right? The nurse will be angry with me and she will be take it on me and the other work all the time. But also it's not fair because she is there to help the patient. She may have a bad day or she may have just did not intend to harm anybody, but the patient is unhappy. So I had to calm my patient. I had to help him to understand the situation and also has to make sure my nurse is learning from the experience. And also she doesn't feel like she is intimidated or put down or anything like that. Okay. That means I should be responding to the situation, not reacting from my authority, from my leadership and all that. Okay. What I want to do is I want to nurture her. I want to help her to do a better job next time, but at the same time, not feel bad. So that is what not reacting, but responding means. Okay, you do still have to do what you have to do, but in a nice way, in a considerate way, and taking into account what the nurse will feel if you take your anger on her. So learn that, examine that, reflect on them. Suppose you have 3 or 4 encounters today that you are being angry, sharply talking or throwing things and all. I have seen with my colleagues, they throw the charts because they don't want to take another admission. And then suddenly they come and give an admission at 6:30, at 7 o'clock you're going. And that means it delays all the time. And they get so upset because they are bent on going home. And last minute they have more, somebody came to the emergency room, they had to call you and you go there. And I have seen physician throwing chart. The responsible thing to do is go and there, see what the patient is about. Is there something important or emergency that you need to help the patient right away? You cannot wait for another half an hour to somebody come. Or if it's like a routine case and you can order some labs, you can order some x-rays and all that, and then hand it over to the next person. That's a responsible way to respond. So responsibility itself, ability to respond. Okay. Once you have that, you will not be reacting that way. Other thing is, suppose you react with anger or with resentment or with really feeling bad. That itself causes bad for your health. So non-reactive but responding is a key principle of not developing stress. Okay, so one of the chief instruments for this non-reactivity is deep breathing. What it does this deep breathing, which stimulates parasympathetic nervous system. There is a central nervous system, there is an autonomic nervous system. Autonomic system has 2 divisions. One is sympathetic, another one is parasympathetic. Sympathetic is fight or flight response, right? The moment you think something is threatening you in your mind, and then you kind of react like that. That used to be a protective thing from dangerous animals and all that. But now we imagine dangers and then react. So that's not good for us. But then to nullify that, the deep breathing really helps your parasympathetic system act as an antidote to the sympathetic overload. That's why there's a lot of science behind it. And it's not just being nice or being, being a door, people come and then they wipe their feet on the doormat. You don't have to feel like that. You just have to understand, be above the situation, be above everybody's emotions, and act with wisdom, right? So that you can do only if you practice every day to being relaxed and composed while you are doing exercise. You can start that in the morning with this morning routine I was teaching you about. Okay, so that's the idea. Okay, so so we're almost coming to the top of the hour. This is the last chance for anybody who wants to. That's something bothers me. People don't come and ask questions. That's a way you will retain whatever the insights I'm providing. Okay, so don't be hesitant. I'm not going to swallow you or anything. Just come up and ask questions. And I do come in a lot of people's rooms and come, really contribute. But unfortunately, I don't see many people coming and talking to me. Even the management also don't provide any help for this proactive wellness, which is a very valuable thing for people to have. Okay, so only a few more minutes left if you want to come up and ask me questions. And because I opened on so many platforms, I can't concentrate on only one, but whoever comes, I just allow them to ask me questions and then go from there. But anyway, once again, I'm Dr. Raofo. I'm an internal medicine doctor and a yoga practitioner, Advaita Vedanta practitioner, Ayurveda practitioner. I'm more like a student in all those areas. And also, I'm an informatician too. So I deal with the big technology and big data, EMR, and all that in the hospitals. Then I do come on the social media to really encourage people to be well, to take proactive actions to keep themselves well in all situations, not only in their work, in their life, in their family, and all that. So I myself kind of away from personal. I deal with the doctors as friends and then help them and all that. But I did not see a doctor for my personal health problem in about 10 years now. Okay. So I don't take any medications, but by having this lifestyle that is well informed, wise from the insights of the great people of the yesteryears and then present year, that means ancient wisdom and modern medicine, I do implement those principles. That's why I live well. I live with energy. I have a purpose. I do contribute to people's lives. So I feel meaningful about that. Okay. Everybody can do that. You got to give the time and energy and understanding of how to be proactively well. So wellness optimization is my goal in my PA PAL LLC. That is the company I found in 2020, in the beginning of the January of 2020. And then ever since, I have been promoting services to help doctors and nurses with the burnout, and IT professionals with stress exhaustion, and company leaders learning about servant leadership. Okay, corporate health also I promote. Basically, I promote the health, corporate health, and society health, individual health, and the planet health. Okay, wellness of all these things are very important to me, and it gives me meaning and purpose in my life. And I have helped a lot of people, not only as patients of mine, but also as seekers of this wisdom that whatever I learn, I try to share. And people who are interested in that, they ask me questions, and I usually answer to the best of my knowledge. But I never stop learning, though. So I always seek up learning what are the intricacies, what are the things that I will. So that's an important thing. Always keep the mind in a quest mode, always seeking to learn, and that helps a lot. Okay, Doris, come up. I want to talk to you. So maybe Doris at work. I don't know. So it's a question of having all this. Yeah, there's Doris. Hi, Doris.
Dr. Raofo.
How are you?
I'm wonderful, thank you. I've been listening to you, but I do have a coaching session in like 4 minutes. I just wanted to say good morning to everybody, and beautiful conversation today. I enjoyed it.
Yeah, I plan to do this every day, Doris, because I want to wake up and then wake up everybody for their proactive wellness.
Well, you're setting a perfect example for everybody with it. So thank you for doing that.
Yeah. You see, today morning I was listening to a talk from India. They were calling their medical system medical mafia, because it has evolved into a system of just taking money and making people do tests and other things, but they are not telling them how to be well.
Exactly.
Same here too. So that's why I kind of want to come up and talk about this.
It's an important conversation to have. That wellness starts within ourselves rather than on the outside.
I want to collaborate with people like you who are doing a very good service, I think, on the Noom Vibe about wellness. So we will talk about some of my insights, some of your insights, and then it will be good. Okay.
Yes. Yeah. Let's get together. I'd love to do that.
Yeah. Sure.
I gotta hop. I have one client coming on in just 2 minutes now, so I gotta get back on Zoom. But thank you so much for a great start to my week.
Yeah. Sure, I will be doing this every day. Thank you.
Thank you. Bye-bye.
Bye-bye. So that is Doris. I go to her room because she does a lot of good stuff for the people. And what is happening is people are really... Okay. Thank you. And I'll be seeing you again tomorrow. Okay.